Way back in 2011, I got my appendix out. Shortly after that, I started having multiple digestive issues. I was just thinking it was a side effect of the surgery, thought nothing of it. But after 4 months of constant pain, I finally caved and went to a doctor. When they told me they didn't know what was wrong with me, so they ordered blood tests, and it was a tedious process before a panel came back positive for celiac.
I'm Madeline. I'm a senior at Campo Verde High School. I do basically just orchestra and work all the time.
When people with celiac disease eat gluten, their body mounts an immune response that attacks the small intestine. These attacks lead to damage on the villi, small finger-like projections that line the small intestine that promote nutrient absorption. When the villi get damaged, nutrients cannot be absorbed properly into the body.
In May of 2012, before that I had a lot of other issues going on in my intestines, and I was sick for basically 4 months straight all the time. We were surprised when we first heard that I had celiac, because celiac is a genetic trait and it is not common among the population. We had never even heard of it, so it was, oh, okay, what is this? So before I was diagnosed, and every time we call it getting gluten, as in our food gets touched by any form of gluten, and we eat it, then we get a reaction. So basically, usually I feel a lot of cramping in my stomach. I get sometimes nauseous, not hungry, and cranky, and sometimes depression or anxiety will result from that.
Well, usually it's diagnosed based on clinical grounds. The patient comes in with symptoms, diarrhea, malabsorption. Actually, anemia is the most common presentation for celiac disease, but laboratory confirmations are usually done with blood work, so there's antibodies that can be confirmed with blood tests. Blood test is not always 100%. So everything has to be taken into account. I mentioned malabsorption. So actually, one of the other diagnostic options is endoscopy. So patient undergo, whether it's normally it's EGD, endoscopy. So and the biopsy samples will show inflammations in the lining of the intestines. Now, in terms of the presentations, how the patient comes in, what they're complaining about. They complain about weight loss, abdominal pain, gassiness, bloating. Anemia is usually confirmed on blood tests, and then from there we actually look for antibodies in patients' blood. The most important thing is avoiding gluten. And then that's a wheat product. That's a lot easier sounding than in actual practice, because gluten is in literally everything. So for these people to really be strict with gluten diet, it's difficult. So whenever they get exposed to a gluten protein, then these patients will actually, some patients will immediately have symptoms.
Some foods Madeline cannot eat are bread, cereal, various dressings, cookies, and pasta.
Well, the worst case scenario, I suppose these people can be so malnourished that they fail to thrive. Probably can lead to death. Basically, your intestines just does not absorb any of the nutrition, so you're deficient in not just the regular calories, but also in minerals, vitamins. So yeah, it can lead to quite a variety of diseases, problems. A lot of people now are talking about using a gluten sensitivity, avoiding gluten. So it's not a matter of awareness. It's a matter of doing the research and how to treat it. As of right now, the only thing I'm aware of is avoidance as a way to treat the disease. There's no medicine or drugs to treat it.
An estimated 1 in every 130 Americans, or about 1% of the population, has celiac disease. And it is estimated that over 80% of Americans who have celiac disease are undiagnosed or misdiagnosed.
Alright, so the only modifications for celiacs is in the kitchen, so nothing gets cross-contaminated because I'm the only one in my family with gluten-intolerant celiac. Everyone else is fine, so since gluten food is so expensive, we obviously the rest of my family will still eat bread and whatnot. So we got gluten counter here, their toaster, and so this is where they keep their stuff, and I keep away from this counter at all costs. And here is where they keep their bread and stuff. We have it blocked off. You can kind of see right between here. So nothing moves over, gets contaminated, so I don't have to worry about any of the spices. And over here is where I keep my toaster, because I can't use their toaster because it'll make me sick. And we also go through a lot of paper towels because I can't use our towels because you never know what's on that. It's weird. Then we've got another portion blocked off for their cereal. The rest of it's saved, and then all the gluten-free stuff is kept up here in this cupboard. Everything was completely wiped down, pulled everything out, cleaned, because we used to keep our flour up here. So now it's just all gluten-free stuff. They're all very supportive and nice about it. They always think about me. They, like, especially during social gatherings where I can't eat anything, sometimes they'll make me food or just anything. They're very supportive. Emotionally, it's rough because I'm not sure exactly why, but it gives you mood swings sometimes, really just uncomfortable, and then you get upset, and which leads to depression. Oh, like I said, every social activity is hard because there's never anything I can eat there, because if it's even sitting on the same table as something gluten, say like cake versus a gluten-free brownie, and they're sitting next to each other, there's a possibility of it being contaminated, and I can't eat it.
And do you have a message to anybody viewing right now that has any medical problem?
Get it taken care of, follow the rules the doctor has told you. Yeah, getting through it, it's hard, but it gets better, and they're worse things.
Living gluten-free has been a daily nuisance and a life-changing condition for Madeline. She views this disease as a blessing and has matured into the woman she is today, while regularly participating in routine activities such as playing the violin, the piano, hanging out with friends, and spending time with her family. She also just got a date to prom.